Good evening, friends. This is John Knapp, also known as High, the Healthcare for All music guru, and I'm going to talk about an essay that I put together. Why I am for a single-payer national health insurance system. Oh yeah, you're probably thinking, the only reason why, you just want us to pay for your health care. No, that is not true at all. I have every intention of paying my share of it, just that there be jobs to be had. I have every intention of paying into this pool, maybe even landing a job that pays more than what you make, so I'm stuck paying for yours. And it is very clear, it's very crystal clear. I mean, you may not all agree on what the answer is, but I think anybody here will agree our healthcare system is broken. Now, I chose to film this outside of the house. As you can probably kind of see, there's been some repairs done on this house. Some, I think, with the some that, with the help of other family members. Not my first choice, but that's a choice I guess I have to live with. And this chair here is also broken, like our broken healthcare system. Now, I'm not just in this idea of a single payer just for myself. No, I believe it is a better choice for all citizens. My intentions would include the doctor who, because of a brain injury caused by an accident or illness, if he would lose his ability to practice medicine, he still will not lose his insurance. And to keep up with the news, there is an organization called the Physicians for a National Health Program, PNHP.org. They are physicians. I mean, are those doctors trying to get you to pay for their care? No, they're rich people. Well, of course, real doctors, I mean, if they get rich, that's good, but that's not the purpose of a real doctor's choice. A real doctor is here to help you, even if it doesn't make him a millionaire. Now, I really believe that this is the best choice for all Americans. It cuts off the cost shifting, and it will it'll cover those 49 million who are currently uninsured. It will eliminate the cost shifting, and I realize that many do oppose because they fear change. The insurance companies don't want to give up their profiteering, so they are using all kinds of scare tactics and fear mongering. And now it is true too that I had a hard time with the United States healthcare crisis. But that's not my only motivation. I'm not just in it so that I can have insurance. I mean, it's not something. Having a wife with heart disease and being in the upper 50s, we don't give up that privilege of having insurance if it can be helped. That is very true. Now, I really believe it is in the best interest of all Americans. And I think that really is all Americans. That would include the Americans that were scared by the health insurance companies' scare tactics out of calling for a single payer. It's in the best interest of those too. Well, nice thing about the insurance companies, if some people say, "Oh, you're going to make them lose their jobs." Nice thing about it is, even if they did lose their jobs, they're not going to lose their insurance. Yeah, they'll have insurance. The only thing is, they might have lost their job another way if we stayed with the privatized, with the kind run by the health insurance pirates. They might get sick and not able to keep on working. Conservatives quickly tell you, well, let's get rid of the frivolous malpractice suits. I mean, and I will agree that Frivolous malpractice is a serious problem, but it's not the only thing wrong with our health care. But here's another reason for a single payer. It'll go a long ways for curing the bad malpractice suits. Currently, if a doctor makes a mistake, I would probably had better sue for future medical bills. Now, if healthcare was a guarantee, I would only need, pain and lost wages. I would not have to sue for future medical bills. Now the biggest reason of all, I believe this is the Christian way. Now I will tell you something. Now I believe in spite of much controversy among the Christians, if you would like to try listening to what Jesus is saying, you would look beyond what you have heard against a national health system. And I really be honest with yourself. It actually will start to make a lot of sense to you. Now I like what Michael Moore said in his movie Sicko. Not socialized insurance, but Christianized insurance. I don't discourage listening to the groups who oppose the single payer or other types of healthcare reforms. It is important that we look at both sides of the story. One problem that we now have, and one problem that our now disabled is facing, if I would get a job, I would lose my Medicaid benefit. Oh yeah, there's a problem. So those that rant and bellyache about how welfare recipients are eating up your tax dollars, well, right here, there's a problem that they did not cause. That's a problem. The lawmakers caused that problem. The lawmakers caused that hazard that if they would... I can't really blame anybody for trying to hold on to their insurance. I mean, that having insurance is something we've got to have. If he would lose his job, he would lose it, or if he would get a job, he would lose his Medicaid. Now, if we convert to single payer HR 7676, that would eliminate this threat. Everyone will have it, so it wouldn't matter. I've long felt the need for more incentives and less disincentives for a now disabled welfare recipient to try to seek work. We needs to be where disabled and welfare recipients can try to work without the risk of losing his medical insurance. Then if the new job doesn't work out for him, he can just return to the welfare and disability until another person is willing to take a chance at hiring him. And another thing, I also believe that conversion to a single payer or some meaningful form of healthcare reforms will let doctors be doctors and not slaves to insurers. And I've had these words in one of my songs, which is actually a Fireflies parody. Let's doctors be doctors, not slaves to insurers. If a doctor needs to prescribe a medication or treatment, he can do without regards to whether the patient can afford it. A doctor is no longer torn between the funding and the Hippocratic Oath. I have seen on a video obtained from Healthcare Now a lady studying to be a doctor, and she was really afraid, wondering how can she keep the oath to do no harm with our currently fragmented healthcare system. Now I have another idea here. Proper healthcare reform will reduce crime. Our jails are currently overcrowded with mentally ill people who lack affordable access to psychiatry. I'm not saying that mental illness is responsible for every crime committed. An incarcerated spared will save us taxpayers $50,000 a year. Furthermore, with so many people owing medical debts, I am afraid that I will get ripped off by somebody that is trying to be able to meet the demands that people they owe. I also share the same thing in my essay, I Don't Want to Pay for Your Health Care. My biggest concern over privatized health care is if you make this a personal responsibility to obtain the kind of job that lets you have insurance, who will be the first one unable to hold or obtain that kind of job? My guess is the sick. I mean, you have any concern about, like if you would get sick and you can't work, or else maybe cancer and you're spending more time in the hospital than you are at work, and you're not able to keep up with the insurance premium. I mean, are you okay with that? And also, like the preamble of the Constitution says, I'll back up. There is a very serious moral imperative regarding our USA healthcare system that everybody of all religious affiliations must address. Furthermore, our privatized care is sending a bad message to those lucky enough to be able to afford good insurance. So many of the lucky people are learning to say, you can't afford health insurance. That's not my problem. The preamble of the Constitution starts off, we the people. It does not start off, they the rich folks. And here's something that may come up even more controversial. I believe that conversion to a meaningful type of healthcare reform like a single-payer H.R. 676 will reduce abortions. Many pro-lifers fear that if we have free abortions, abortion will skyrocket. Now, I am pro-life. I am as much against abortion as anybody else, but I believe that the very opposite outcome will result from a single payer. If a woman becomes pregnant and has no medical insurance, what is she going to do? She can't afford the care for complications that will result in her pregnancy or the needs of her child. Here is a very good example of why we need a more meaningful type of healthcare reform. Now, I've learned from experts that, here's real crystal clear evidence. I have learned from some people fear that it's going to cost more. Basically, our privatized is a very expensive way to do it. And I've learned experts say it costs less to cover every citizen through a single payer or some comprehensive form of universal health care. And that would be good for our economy. Privatized is a very expensive way to do it. The CEOs make millions of dollars a year. And yet, 1 in 6 of every American is unable to afford insurance. Well, I am approaching 15 minutes, so I'll probably do the rest of it on another page. See you later. I love you all.